This segment of Coast Life is sponsored by Beebe Healthcare.
We always like to talk about different health things going on here along the coast. We've got so many people that have health questions for us. We try to bring in experts when we can. And today we have a great one. We have Dr. Chris Caputo joining us today from Beebe Urology Lewis. And Doc, you specialize in this thing that you're the first one to do in Delaware. Can you explain what is an aquablation? Am I saying that right? What is that?
Yeah, aquablation, it's a minimally invasive treatment for benign prostatic hyperplasia, or BPH as we call it. It's an image-guided procedure to basically ablate or kind of eliminate the inner obstructive prostate tissue in men who have symptomatic BPH.
Now, a lot of that is technical for the people at home. Firstly, there's like a robotic component in all of this, like in this minimally invasive procedure. How does that work? What are you doing? Are you like operating a robot? What's going on there?
So it's, like I said, it's image guided. So we basically get an ultrasound image of the prostate in live time. And the robot component of it comes from creating a targeting plan using that ultrasound image, and through a scope, the robot essentially delivers a high pressure water jet to the targeted area of the prostate, which is included in the treatment plan. That is part of it.
So how different is this than, say, the way it had normally been done? You know, what sort of advancement or departure from the norm is this? Again, because you're the one that's doing the first ones here in the state. So what were the options before this happened, and now why is this a better option?
There are many different options to surgically treat BPH. The gold standard procedure, it's been around for about 100 years, is called the transurethral resection of the prostate, or the TURP. That involves resecting bits of the prostate through a scope, little by little, in order to kind of create an open channel that makes it easier to urinate. This takes that concept but delivers it in a much more accurate way and minimizes potential side effects of procedures.
And that's kind of always the goal, right? Like when people come in, you want to get them back to their regular lives as soon as possible. You want as little damage, I guess, done as you can get. So how common is this issue? Who should be looking into maybe whether it's getting a consultation or whether it's really time to move forward? What is it, if I'm the regular person at home, what do I need to be looking for to know, oh, I need to go get checked out for this?
So BPH symptoms typically involve weakened urinary stream, urinary urgency and frequency. Patients often complain that they're running back to the bathroom after 5 minutes to empty their bladder. Nighttime urination, waking up several times a night, is very common as well. And at the extreme of it, urinary retention, where someone would require an indwelling catheter in order to empty their bladder, is a long-term potential consequence of letting BPH going untreated.
So what made you decide you wanted to get into this specific newer technology? What brought you to it, and what made you kind of, spend your time and effort into getting trained up on this?
So I have spent my career doing lots of different minimally invasive urology techniques. I do robotic surgery. I've done whole-lep procedures, which is a different way of treating the prostate with a laser. I've done TURPs. I've done many other kinds of prostate procedures. The data for aquablation shows the best long-term benefit to side effect profile, meaning that you get the most benefit and the least amount of side effects long-term.
Nice. So again, if I'm somebody that's trying to debate next steps, maybe I'm somebody at home who's starting to have, am I going to the bathroom more than usual? Or am I waking up at night and going more than usual? Who should I go see first? Is it to come see somebody like you right away, or is there an intermediary before I get to you in this stage? How does that work?
Well, oftentimes patients will have a primary care provider who they are seeing for for other things, and they'll mention this to their primary care provider. The primary care provider may start medications or may just make a referral to urology. There are medications that are effective for treating BPH. The problem with medications is that 70% of the time they work, which means that 30% of the time they don't. And medication compliance, or actually taking the medication regularly, is necessary for it to work, and sometimes people don't just take them.
Well, is there anything else we should know about this? Anything that somebody that's considering this should know? How do they get a hold of you to start this process?
Yeah, so we usually start a process with an office consultation with me. I go over the patient's symptoms, do a physical exam, and talk to the patient about what their goals are for treatment and how they are now compared to how they are with medication, because medication is usually our first step.
This is relatively new down here, at least in Delaware. So is this something that you guys are excited about, to be able to bring this sort of treatment and or technology to the people here?
I'm very excited to bring this to the community. We are the first center in Delaware to offer this treatment to patients. I'm the first surgeon to perform it in the state of Delaware, and I am amazed with the technology. It is a very efficient procedure. It's a very effective procedure for patients. Oftentimes it is an in and out hospital visit, and patients will go home the same day, and the results are great for patients.
And I was going to ask about that. You covered it there a little bit, but just that recovery time seems like, comparatively to some of the previous options, it just seems quicker.
So the recovery time is about 2 weeks of light activity for recovery, just to prevent any post-op complications.
In 2 weeks, we can all do that. So, Doc, thank you so much for coming in. If anybody is interested in this, if anybody's trying to get a hold of the folks that are doing this, you can go to Beebe Urology Lewis. They've got everything happening there. That's where the doc himself is. We appreciate you coming in, and thank you for talking to everybody at home, letting them kind of know what the options are when it comes to this sort of procedure.
Thank you for having me.
All right, everybody, stick around. Don't go anywhere. We have more Coast Life. It's coming up right after the break.